Well, October is Breast Cancer Awareness Month. According to the American Cancer Society, breast cancer is the most common cancer in women in the United States, except for skin cancers. Joining me now to talk about this important topic is Dr. Rihanna Menon, the Director of Breast Surgery for St. Luke's. Doctor, thanks so much for being here today.
Thank you for having me.
Of course. So breast cancer, of course, unfortunately affects a lot of people. So what would you say are some tips to help with early detection, and what kind of testing can really help?
So our best tool for early detection is really mammograms. And that's because most of my patients cannot feel a tumor or a cancer that's present. And so when they come into my office, I, as someone who does an exam every single day, I know exactly where to look and I can't even feel it. So mammography really picks up on things before they are able to be felt. And the opposite of that is that if you are feeling something, noticing a new change, new skin changes in the nipple, these are things that if you get a mammogram and an ultrasound and it's clear, you have really good peace of mind to know that you're doing really well.
Okay, good to hear. And it sounds like mammograms still, like you said, the best option, still something reliable that's been around for a long time, or hopefully reliable. But, as medicine has been evolving, treatments, of course, change throughout all of medicine in general. So are there different treatments that you can use or know of changes in the future coming up?
Yeah, we're very fortunate in breast cancer to have amazing data and studies that are coming out all the time. So breast cancer treatments change every few months. And so what I encourage patients who are going through a breast cancer treatment and have friends or family that have been treated in the past, treatments that were 5 and 10 years ago are almost completely different than what we are doing now. And so just realizing that every person's plan is made just for them. And the trend over the last 20 years is really less invasive surgery, less radiation, shorter courses, and about 2/3 of early breast cancer don't require any chemotherapy at all.
Okay, good to know there. Yeah, I think that's a little bit of relief there. But for those that do unfortunately get that diagnosis and know they need to do something about it, what are some of the procedures for those that are battling breast cancer?
So when I talk about breast cancer, I make an analogy. It's like saying you have a pet. Some people have a goldfish, some people have a dragon. That's how different they are. So obviously the treatment for a goldfish is much different than a cancer. A small amount of surgery, almost no need for chemotherapy, a small amount of radiation or none, versus a more aggressive cancer like a dragon cancer. It's not that you won't do well, it's that we have to use that more aggressive treatment, that dragon medicine. So in those cases, maybe chemotherapy is needed. To emphasize, though, most people do very, very well. What I say to my patients is, it doesn't matter what we find, I have a plan for that. And we have a group of doctors that works together to make sure that the plan is individualized to each and every patient.
Wonderful. That sounds great. Now, of course, the people that are fighting breast cancer or any type of cancer, really, they're in a world of not great themselves, for lack of a better phrase. But what about their families? Obviously, it's not easy for the families. So what would you tell the families of those battling cancer to be able to help their loved ones?
Yeah, cancer is just the word itself is so scary. But one of the things I emphasize is that the word cancer means so many different things. And so as scary as it is for our patients, their families really are just as scared. And so staying very hopeful, knowing that things are changing so quickly, that we really do have a huge array of options for most patients, and that most people do very, very well. So my best advice is to stay very hopeful, to stay helpful. So things like bringing a healthy meal, being around to help clean up around the house or watch kids. These are things that can actually keep the burden off of our patients, and it actually makes us as friends and family feel like we're doing something in return.
All right, great tips and positivity there. Okay, and for anybody else who wants more information, where can they go?
They can go to breastcancer.org, they can go to the Komen Foundation, and they can look for early detection availability with their own doctor.
Perfect. Okay, well, joining me this morning has been Dr. Rihanna Menon, the Director of Breast Surgery for St. Luke's. Doctor, thanks so much for being here and discussing this important information.
Thank you for having me.